Hi folks, Dr. Ed Beyer. This week we're talking about fibromyalgia or chronic pain syndromes and chronic fatigue. Now, the first thing I want to say is don't ever fall into that trap of thinking that just one thing or even two things is causing your chronic pain and your chronic fibromyalgia, okay? There's always, it's like a perfect storm, there's always multiple things. But today we're going to talk about one of them, and that's a condition known as small intestinal bacterial overgrowth. But before we get to that, I want to first explain that fibromyalgia is a neurological problem. You are either having what's known as central sensitization, which means that the neurons in your brain that perceive pain are hyperexcitable, and you may have a pain level of a 2 in your lower back or your neck, but your brain's perceiving it as a 10. So it's an over-exaggeration of pain. Or allodynia, which means you don't have any tissue destruction, nothing going on in the body, but you're still feeling pain. So there's pain perception even though there's no pain at all. So this is a neurological problem. Now what really is happening in either one of these is that the neurons that perceive pain are unhealthy and to the point where they're overfiring. And so this is very common condition that we see in any brain or neurodegenerative disorder, especially if you have sensitivity to light and sound and anxiety and things like that. So this can happen due to inflammation, and one of the leading causes of inflammation, and a lot of studies have been showing that people with small intestinal bacterial overgrowth, SIBO, people with fibromyalgia almost always have overgrowth of bad bacteria in their small intestine. These bacteria will produce inflammatory chemicals that easily get absorbed in the bloodstream, and they pass through the blood-brain barrier, causing these areas, these pain-perceiving areas of the brain, to malfunction. Now, what would cause a SIBO or small intestinal bacterial overgrowth? Things like a poor brain-gut connection. There's certain areas in your lower brainstem that control the gut, and if that's not working well, this can happen. Low thyroid, which is why a lot of you who are suffering with low thyroid have irritable bowel or digestive issues. Taking antibiotics or proton pump inhibitors like Nexium and Prilosec or omeprazole, things to reduce acid. Infections, which we see all the time clinically, poor standard American diet, and having poor gut flora. These are the causes, and what's causing these, the only way we're going to know is through proper testing. I'm Dr. Beyer. Hope that helps. Have a great day.